So hi everybody, thanks for joining us. This is Mondays with Maddy, and I'm so glad that you guys are here to join us. And this evening we have Dr. Jolene Aries. And she is a practicing psychologist in Northern New Jersey. She specializes in anxiety management as it is the root of any mental health issue. Dr. Aries currently has a private practice working with adolescents, adults, and families, and she resides in Allendale, New Jersey, with her husband and 2 little boys. She started her private practice in 2012, where she continues to work with her clients on managing their anxiety and provides an educational approach to her work. She wrote a book, Why on Earth Do I Feel This Way?, after more than 15 years of practice in the field, recognizing a major theme throughout her work across settings, ages, demographics, and diagnoses. The theme was anxiety, and that anxiety is rooted in lacking a sense of personal control. Dr. Aries' control theory can be applied to all ages. She is a strong advocate for mental health education becoming a requirement in school curriculum for all ages. So with that, we like to welcome Dr. Jolene Aries. Thank you so much for being here tonight.
Thank you so much for having me. This is a great privilege. I'm happy to be here.
Great. So I just want to ask you some questions. I guess we'll get into it. And yeah, I mean, I love how you kind of focus on anxiety and also the control aspect of it. So without further ado, I'll just get started.
Sounds good.
Okay, so please tell us a little bit about yourself, your career as a licensed psychologist.
So I started out, I went to undergrad in Pennsylvania, and from there I went right to my graduate work in Boston. And I remained in Boston for 10 years doing my pre and postdoctoral clinical work. And throughout all that, I had been working in outpatient facilities, school systems, the Boston Juvenile Court Clinic, and I was a clinical director for a substance abuse treatment program for residential services, a shelter, and outpatient, and then other group practices. So I got a bit of experience there, and then from there I moved to New Jersey about 9 years ago and started my private practice. And I've really been trying to hone in on, I guess, more of a theme of the underlying roots of mental health. And that's what drove me to focusing on anxiety.
Oh, that's wonderful. That's great. Okay, so like you said, you focus a lot on anxiety. You even wrote a book about it. Anxiety is clearly a problem facing many teens and young adults today. So can you tell us a little bit about your book and what exactly is control theory?
Sure. So I wanted to write this book. It doesn't seem very groundbreaking, but the more I researched anxiety and, just through my own studies and education, there wasn't a whole lot in there about control, because when I was really looking at the root causes of mental health issues, I was trying to backtrack my clients' experiences and not just focusing on their symptoms, but trying to look at what precipitates their symptoms. And that's where I started to see a theme of anxiety. And so I tried to focus more on the roots of anxiety, taking it one step further back. And that's where I was focusing on, or recognizing that there was a theme of a lack of control. And that was consistent across the board with any case I had, with any diagnosis that came across the table, different facilities, different ages, different demographics, you name it, there was a lack of control at the root of all of this. But the lack of control is not addressed in clinical theories, typical clinical theories, and the need for control is listed as a symptom of anxiety, but that's it. That's as far as it goes. Nobody's really broken into, really analyzing the role control plays in our mental health. So I started focusing on this theory with all of my clients, and it seemed to be resonating with everybody I was working with. And this is from kids to adults, and older adults too. And again, it didn't matter what diagnosis they came in on. I just focused on the anxiety. And especially with depression, they're related. They're very, very closely related. And that was one thing that I had kept my eye on, as well as I came across a lot of providers and facilities who talked about anxiety and depression as two separate things. And they're not. And when I was focusing on the depression or focusing on the root causes of depression, it always led me back to anxiety. That was the precipitant to the depression. So in my clinical work, when I focused on treating the anxiety specifically, not focusing on the depressive symptoms, but using them as mile markers to make sure that they were decreasing, I was able to actually decrease the depressive symptoms would subside when I tackled the anxiety. So it was giving me more evidence to show that the anxiety really is at the root of the depressive symptoms if you tackle that anxiety. And I use a scale from 0 to 10 to gauge the level of intensity of anxiety. So 10 being the worst, 0 being I feel absolutely fine. When we are higher on that scale, we can't live up there. Eventually we feel like we kind of hit a wall and we're in this it feels almost like a burnout, but that's when depression comes into play. So the depression looks very different from the anxiety, and people who are experiencing depression, you're not going to see the typical anxious symptoms that they may have had before. And you'll hear that from a lot of people is that I don't have anxiety, I have depression. But they're past the anxiety point. And that's what's going on neurologically too, is that the neurotransmitters in your head are changing. There's a different reaction in your brain when you have depressive symptoms versus anxiety. But it's more on a continuum, though the depression is on a continuum of that scale. So I try to tackle that anxiety to get to the root of the depression.
Okay. I mean, it makes sense, I've never really had somebody explain it like that before, but it totally makes sense. So like, the anxiety, if you don't really take control of it or solve it or treat it in any way, eventually can lead to depression.
Right.
Can you have both at the same time? Can you be suffering from both at the same time?
You can, yeah. And everybody's different. So some may kind of vacillate between feeling sad or having some of the depressive symptoms, other days feeling a little bit more anxious. They might kind of vacillate. Others are more on the depressive end of it because they've kind of hit that wall and they're done. They stop caring about certain things. Their motivation to do things they used to do are gone, and they're done.
Yeah.
So it kind of varies. When they haven't hit that point on the scale, you tend to see more anxious manifestation of their behaviors.
Yeah, but I like how you said that, it's different for everybody. Like it's not a one size fits all thing. So
exactly, yeah.
Talk to somebody who's suffering from anxiety or depression or whatever it might be, and it doesn't sound exactly like what you're going through, neither one is wrong, neither one is right. It's just what happens.
Yep, exactly.
Yeah, it's interesting. So, a lot of parents follow us and, they connect a lot with Madison's story and that they use it as, like a warning sign, and it teaches them that they really want to talk to their kids about this, especially kids who might be going off to college or even younger children who are, going off to high school. Those transitions can be hard. So what are some steps that parents can take when their kids are young to ensure that anxiety won't control their kids' lives, or that they know how to, kind of handle it in their everyday lives?
Yeah, that's a very good question. One thing that I always encourage and focus on is communication. Communication is one of our biggest tools to help increase that control. So when we're high on that scale of anxiety, our control is way down low. So we want to be able to bring this anxiety down on that scale. And as that anxiety comes down, that control goes up. One of the biggest tools to help bring this anxiety down and bring up that control is communication. So the more we're able to vocalize either what I'm thinking about, what I'm feeling, what I'm worried about, what I'm anticipating, if I can put that out there, I can then focus on basically problem solving, focusing on what is within my control, given the circumstances, or if this is what I'm worried about, here's what I can do. Here are my options. So I'm shifting my focus to what is within my control and training my brain to problem solve. Our brain doesn't naturally think in a logical step-by-step way. So with mental health and therapy, that's what you're training it to do. It doesn't do that naturally. Naturally, our brain stays up here and it focuses and perseverates on those anxious thoughts, the what ifs. Well, what if this happens? What if that happens? And what's this person thinking of me? And what if I don't meet this expectation? All of those thoughts, I call them automatic thoughts. They're the thoughts that pop into our head and just start to rev up that anxiety. And we become so consumed in those thoughts that we're not able to focus on what's actually happening in the moment. And that's where that anxiety lives. I become so consumed in all those anticipations or assumptions, those what ifs. I become so consumed in them that there's where that anxiety lives. And we want to be able to get out of that and become aware of them, have more awareness around what I'm actually thinking about, because most of the times we're not consciously aware of all of the thoughts in our head, but we're feeling the anxiety. So it takes practice becoming aware of what I'm thinking of or anticipating. And then we want to challenge those thoughts and ask ourselves, do I have any evidence or proof that that's true? Do I know for a fact that this is going to happen, or that this is absolutely true? Because more times than not, I don't have that proof. But the way our brains work is that once I start assuming something, I believe that it's true, and then that will lead to another thought and another and another and another, and they just snowball. And again, there I am consumed in those thoughts, and that anxiety takes control over my focus. So I need to challenge those thoughts. You know, if we want to be able to identify those worries, put them out there, communicate about them with our kids, and then challenge them. Ask yourself, where's the evidence? Where's the proof that that is absolutely true, or that's definitely going to happen? If I don't have proof to support that, I want to shift my focus to what is happening in the moment and what is within my control. So problem solving. If I'm anticipating something that could happen, because sometimes we're anticipating something to happen because it's happened before, so there's some validity there, it could happen. Now, I don't know for a fact that it's definitely going to happen, but if I'm anticipating it, that it could happen, we want to come up with a plan of what I can do. So again, it's problem solving. You know, let's come up with a plan A if this situation happens. And if plan A doesn't work, what's plan B? If plan B doesn't work, what's plan C? So I'm already identifying what my options are, what I can do, and what's within my control if that situation happens. And so even just by coming up with a plan, what I'm doing on that scale is I'm bringing my anxiety down and my control up, just by coming up with a plan. Even if it's just a little bit, I'm starting to level myself out on that scale. And so we want to keep training our brain to shift our focus to what is happening in the moment and what I can do. What are my options? And if this doesn't work, what's the next thing? So you're really training your brain to think in a more logical step-by-step way, which it doesn't naturally do. It naturally just gets consumed in those what ifs and those anxious thoughts.
Well, that's so interesting. But I mean, it makes total sense, you know, like problem solving and how our brain is more like emotional, obviously. Wow, that's really interesting. Okay, so we know that transitions can be hard, that anybody can suffer from anxiety and depression and any mental illness. But, you know, Madison was a college athlete. So we see with college athletes that they kind of feel this pressure and they can feel overwhelmed and like they kind of have to do it all. Do you think this puts them at risk for developing anxiety and depression, like more than others?
That's another good question. I think there's anxiety already rooted there, even though it may not necessarily be recognized mentally or physically. And what I mean by that is that one of the things that underlies anxiety is expectations. Whether we put expectations on ourselves or we feel like others put expectations onto us. The way we interpret those expectations is in a very rigid, black and white, all or nothing way. That I may be expecting myself to perform at a certain level. And I think this is very common for athletes who go on to perform at a college level. You know, it's a high level of, you know, athletics. And, you know, there is a certain, you know, unfortunately, there is an expectation that, well, you're at the college level, you're expected to perform at that level.
Yeah.
So there are these pressures, and especially from ourselves. And if we've always had this notion in our head that I'm expected to perform at a certain level, if I don't meet that expectation, I will interpret that as a failure.
Yeah.
It's all or nothing. And that's the dangerous part, is that we, as well, with our children and when we're younger, we need to learn how to live in that gray area. And know that, yes, I want to work my hardest and perform my best and reach these goals, set goals for myself, but the goals are not expectations. The goals are things that I'm working up towards. And if I don't meet that goal right away, I want to be okay with not meeting that goal right away and seeing that, you know what, I worked hard, I'm still proud of what I've done, but I'm going to keep working on what I need to do to accomplish my goal. I'm going to modify what I'm doing to accomplish that goal, and to be okay in that gray area and not automatically interpret it as a failure if I don't meet that goal right away. But as kids, we're not really taught that. You know, as kids, our brains naturally think in a very rigid black and white way. We think that way until we're about 10 to 12 years old. So when our brain is conditioned that way when we're younger, and we continue to have those expectations on ourselves, we're not taught how to have that, I call it flexibility in thinking, being in that gray area, we're going to continue to think that way. And so when we get to that high level, now there's more pressure. Now, if I don't perform this, there's more at stake. According to myself, I may, lose a scholarship. I might disappoint my parents. I might, have a bad reputation, whatever it is. There's more at stake that they feel oftentimes. And so, but it's that very rigid thinking. And so we want to teach our kids, kind of going back to the problem solving, we want to work towards these goals and work hard and know that you're putting in your best effort. But if you don't meet that goal, or if you don't win the race, or if you don't get an A on that test, it doesn't mean that you're a bad student or a bad athlete.
Right.
You worked hard. So let's keep working at it. Let's figure out what I may not have done as well and build on those skills, whether it's, on the field or academically, but to learn from what we may not have done so well and keep working on it, keep improving on those skills. But again, as kids, we're typically not taught how to be in that gray area. We just think in that very rigid black and white way.
Yeah. And I think Madison was definitely a perfectionist. And so she saw like any little, not getting an A or not winning the race as a failure. I think it's interesting how you said like a lot of that is self-inflicted because we're kind of our harshest critic, right? And I think that was Madison for sure. Like my parents weren't, overwhelming or anything with that. I think she really held herself to a high standard. So
right.
Yeah,
And when we don't talk about it, we don't know what they're going through. We don't see how their anxiety is rooted there or manifested, and they may not even know. Most people don't, unfortunately, and that's part of why I wrote my book too, is to try to bring awareness to anxiety, because most people are not aware of it or how it works. And so we just don't pay attention to it until it gets to a point where I've already hit that wall, that depression is kicked in. And when we get to that state of depression and it's so overwhelming and I don't know what to do, there's where I start to have those thoughts of, I don't want to wake up tomorrow because I don't want to feel this way for the rest of my life, but I don't know how to get out of it.
Yeah.
So if we can really teach some, foundational skills for our kids and start from the ground up, I think we can do a lot more preventative work with our kids, with our college athletes, anybody. Really putting some foundation in place rather than waiting until something happens or I'm already at that brink. And, at that point, it's hard for me to shift my gears, to train my brain differently.
Right. Yeah, that's true. So in your opinion, and I know this is not a kind of one size fits all answer, but our schools in general, that could be middle school, high school, college, whatever it is. Do you think that they're doing enough nowadays in regards to mental health and wellness? What should they be doing that they aren't? How can they be better? Like I said, I know that there's many schools and some are doing better than others and everything.
Right.
Kind of like any schools that might watch this or administrators that might watch this and say, we want to be better, we want to do better. What can you do? What would your kind of advice be for them?
Yeah, I feel like it's a mixed bag right now. I feel like there are some schools who are taking more of a handle on this and putting more services in place or, mental health professionals in place and educational stuff. So I feel like some people or some schools are doing a little bit more than others. But what I still feel is lacking is the preventative piece of it. I feel like I'm glad that schools are talking about it more. That's definitely a huge, huge, huge starting point and necessary to be able to move forward. So the communication, verbalizing all of this, we need that to be out there. But I don't want it to be talked about when it gets to the point for students where they've already hit that wall. Or they're just way too overwhelmed with that anxiety and they're not functioning well on a day-to-day basis. We need to do more preventative work. And so there's where I've been trying to push for mental health education in schools, focusing on anxiety specifically because it's at the root of it. But there are some concrete tools that we can implement with our students across the board, elementary school, middle school, high school, college age. It's the same approach that I use with every age because it's very concrete And it all taps into the notion of control. And even younger kids, my 5 and 7-year-old, are well aware of how control plays out. And I point it out in every situation, every scenario, every argument. You know, there's a need for control. We all have that natural need. We all have anxiety. It just looks different from person to person.
Right.
But if we focus on that control and teach our kids how to problem solve, communicate, the scale is a great way for kids to just point at and give a number as far as how intense they're feeling. They don't have to even name the feeling, but just say, I'm not good, I'm at a 9. You know, we're not looking for much, but it's a visual tool that I think is very helpful for people, again, of all ages. So doing more preventative stuff, the communication, and also understanding neurologically what's going on in our brain. And I think it's helpful for teachers and parents to understand that there's a reason why we're seeing different behaviors. And to really, again, understand that anxiety is manifested in a million different ways. And so you're not just going to see, you know, a cookie cutter, you know, look at anxiety, but one kid, your own kids are going to look completely different as far as their own anxiety, how that's manifested.
Right.
And so I want to push for this mental health education in schools. But another thing that I feel is likely to be an even bigger impact, have a bigger impact on schools, is that I'm going to be working with a town nearby with all of their schools, all the elementary, middle, and high school, around changing the entire culture of mental health. So it's going to include mental health curriculum, but trying to do it from all different angles. And a lot of that is really setting a lot of boundaries with and for teachers, parents, the administration, and this, of course, the students. But really understanding where each person's sense of responsibility is, and to teach them how to focus on themselves, because that's another thing that I feel is lacking in mental health, is that, and throughout our development, and I know for myself, I was never taught how to focus on myself. I had to figure that out, and I luckily was able to, but that's not everybody. And I did that a lot through my own training. So, you know, I can't expect people who are just not aware of anxiety to know what to do. And so, you know, this is something that I feel is going to have a big impact, is that we need everybody on board. We need everybody to feel supported, and we need everybody to feel like they have a sense of control as far as where their own boundaries are, professionally, personally, you know, what their responsibilities are towards the students, what the students are responsible for. But it's got to be, you know, a full cultural approach to changing mental health and taking away the stigma, and really getting to the root of the mental health through anxiety, understanding anxiety, and for everybody to see that, oh, this is me, this is everybody. You know, I may not feel like I have, you know, mental health issues. I don't have any diagnoses. I don't have struggles on day to day, but I do have anxiety, and I need to acknowledge that and understand it. You know, it's dangerous if we don't acknowledge that, because eventually, if we're not paying attention to it, eventually at some point in our lives, it will catch up to us.
Right.
So it's be a cultural approach.
I love that you're working with the schools, that school district, all the way from elementary through high school, because I feel like that's so important too. You know, start it when they're young and then continue it as they get older, so they know how to cope and they know how to learn about it and what they're going through. I think that's great. And I love the scale too, because, like, you know, you go to the hospital and they have a pain scale there.
Right.
You can point at. So it's like for physical health, you're using that. So wouldn't you use it for mental health?
Exactly. Yep.
Even Madison, I remember when she was going through like all of her hard times and anxiety and all that kind of stuff, she didn't really ever name it. She just would always say, like, I don't feel like myself.
Right.
Who I am. And so it's important to know that, you know, they're not always going to come up to you and be like, I have anxiety.
Exactly. And I've spoken to so many adolescents who, just like that, they don't know how to describe it. They can't put it into words what they're experiencing. But when I tag on the control piece and attach it to, you know, think about any stressful situation you've been in. Where's your personal sense of control? It's been minimal. And that automatically puts us higher on that scale. And when they start to think about it, you know, that's what resonates with them. And then they're able to recognize, holy cow, I've never been able to explain what I've been experiencing.
Right.
But that taps right into what I was experiencing. I don't have control. I didn't know what to do.
Right.
So yeah, the word control, I feel like resonates with everybody. And that's what really helps us shift our focus from, instead of just focusing on what's going wrong, it shifts our focus to, well, here's what I can do about it. It empowers us.
Right. Okay, so social media,
Mm.
about it. It's such a big part of all of our lives today, I feel like, whether it's Facebook or Instagram or Twitter. There's so many different forms. Most people are on at least one of them, if not all of them.
Right.
We are young adults. I know it played a big part in Madison's life. And we've come such a long way since then, even, when Madison passed, Instagram was still very new to us. So that was totally new. We were getting used to that and posting these pictures that looked amazing all the time with filters and whatever it might be.
Right.
And we've come a long way, but I don't think that it's always the healthiest thing. And I don't think being on our phones is always the healthiest thing for us. So what are your thoughts on that? Does social media, you think, increasing our anxiety? Is it a helpful tool? Can it be both? What do you think?
I agree with you. It really has had quite an impact on us. And what I've been seeing when I look through the lens of anxiety and control is that, with social media, people are trying to present themselves in a way that they want to be seen as.
Mm-hmm.
And they're more focused on how other people judge them and view them versus focusing on themselves. It's one thing if people post something that they think is funny, or, I think this is funny, so I'm just going to post it. And I don't care who likes it or not. I'm doing it because I want to share it. Versus I'm doing this because this is how I want people to see me. When we do that, we're essentially giving others our control. If I'm trying to meet other people's expectations again, or trying to present myself to please others, or do what others want, then I'm essentially giving them my control. I'm not focusing on myself. So the more I'm trying to please others and show them that I'm, I don't know, that I have a certain reputation, or this is what I want you to see of me, then I'm giving them my control. And it's going to keep ratcheting up that anxiety, because my personal control is going to keep getting lower and lower on that scale. And that's what's going to take a toll, is that I have to present myself in a way for others to accept me, or to judge me in the way that I want them to judge me.
Right.
And I'm giving them my control. So I always think of it through that lens. And social media, I feel like, has been very, very, very harmful with regard to that.
Yeah.
I feel like it is more harmful than helpful. I know there are some platforms out there that, of course, have good intentions to try to help people and have support networks and all of that. And I believe a lot of people do utilize them and use them for that benefit. But, especially for younger users, they don't know how to navigate social media in a healthy way. And it's not something that we grew up with learning either. So, I think that's a very tricky thing to be using, especially for younger generations or younger kids, adolescents. Because we want to, especially for adolescents, it's part of their development to understand who they are by comparing themselves to others. But there's a fine line there. I need to still be able to focus on myself and do what I think is right for me, or what I'm interested in doing, versus what this person wants me to do, or what they tell me to do. They don't have control over me. I have control over me. It's my decision. But students aren't necessarily taught that. And parents, not to their lack of ability of parenting, but they don't know that either. They're not thinking of it in this way either, because again, people are just not aware of how anxiety is really at work, and how we tend to get so consumed in basically giving others our personal sense of control and not focus on ourselves.
Right. Giving them that control, and we're not valuing ourselves, we're valuing their judgment, essentially. So yeah, makes sense. So kind of like the final question I want to ask you, and I think this is a big part of our foundation, and kind of what we focus on are transitions in people's lives, especially that transition from high school to college. We think that can be especially difficult for some young adults, because you go from living with parents who might do almost everything for you, cook your meals, do your laundry, drive you places, make doctor's appointments, whatever it might be, to then living on your own and having to kind of figure that all out while also making new friends and possibly playing in a sport or, you know, going to these classes. So
Mhm.
transitions can just be so hard on people. What are some ways that people going through a tough transition, you know, whatever that might be at whatever age, can manage their anxiety? Because that can kind of bring on anxiety preemptively before they even go, during it,
Yeah.
you know. So what are some things that you think, you know, with control theory that they could use to apply that to those situations?
Yeah, that's a good question. So looking through the lens of control theory, transitions are hard because when you think about where our personal sense of control is, it's minimal. If I'm going into a new school, I'm going to college, it's a whole new environment, new people, new place, new school, new professors, new everything, new place to
Right.
live. You know, when you think about where your personal sense of control is, it's minimal. So automatically that puts your anxiety way up high. Now, in any transition, there's typically going to be an adjustment period. So there's going to be some anxiety, and that's typical. That's to be expected. You know, I don't want that to be interpreted as, you know, oh no, there's anxiety, but that's normal. You know, we're going to experience some anxiety. But to know that the big root cause of that anxiety is that lack of control. You know, once I get adjusted, things are more predictable. I know where I'm going to class. I know who my professors are. I know what my routine is. I know where to go get food. I know where to grocery shop. I know what I need to do now, and
Right.
I have more of a routine. Things are more predictable and manageable. So it increases my sense of control, which will bring down that anxiety. So getting ready for a transition, we want to try to identify support systems. You know, if I'm worried about getting used to my academic load when I transition to high school or college, what are some options that I can do? You know, is there a guidance counselor I can talk to, or an advisor? Is it possible to switch my classes if I feel overwhelmed? Who can I talk to about this? You know, have a plan, have options in mind as far as what you want to do. If
Right.
I'm not comfortable living away from home, is there an option for me to come back home or figure out a school that might be right for me, or commute? You know, we want to think of different options and really have students think about what is right for them. What do
Mhm.
they feel is right for them? And I know it sounds cliche, but listen to your gut. If you think about going to college far away and that makes you really nervous and your gut tightens up, you want to listen to that. You know,
Right.
your body's telling you something that's not right for me. You know, if I picture myself going to school closer to home and I have more access to my parents and I feel more comfortable with that, okay, then I'm not going to have as much anxiety. I'm going to feel like I have a better sense of control as far as where I'm at. And I
Right.
have options as far as how to manage it. So we want to really, again, focus on what is within my control, what are my options, and really problem solving, coming up with, options as far as what I can do if that transition is difficult for me. But any transition in life, we want to really try to focus on what can I do? What are my options here? And teach ourselves to problem solve and understand that it's normal to feel that anxiety too. So in any transition, there's going to be at least a couple week of, adjustment right from the get-go.
Mhm.
Sometimes it's more, again, I use that loosely, but at least 2 weeks, you tend to see a bit more adjustment after a couple weeks.
Yeah.
But that's typical anxiety too. So I don't want people to feel like, oh, something's wrong with me because I'm having anxiety when I first go to college. You know, give yourself some time to adjust, really try to figure out a routine. We want things as consistent as possible and predictable. So
Mhm.
that increases the sense of control.
Yeah. Well, that makes sense.
Mhm.
So kind of the final question before we wrap it up, but if you could pick one thing, like if somebody watches this and they could take one thing away from it, what would you want that to be?
To think about anxiety and control at the root of mental health. Use the scale from 0 to 10 and use that to gauge your own level of anxiety. Use it with kids. You know, really focus on how to shift our focus back to that control piece. You know,
Mhm.
if we can work on problem solving, practice that flexibility in thinking, not thinking in an all or nothing way, but what can I do in this gray area, and focus on problem solving. We're going to be teaching our kids how to basically get control over that anxiety before it consumes us. But that scale, I feel like, is a good reference for people.
Yeah, for sure. That was wonderful information. Thank you so much for sharing that all with us.
Absolutely.
I'm going to link your book here as well, so people can go find that and, purchase it and read more about this, because I think that it's beneficial for everybody to learn more about it. So I just have a couple little questions that are kind of fun, just so the audience can get to know you on more of a personal level, if that's okay.
Sure, absolutely.
Okay, so who is somebody that inspires you?
Well, I love Eleanor Roosevelt. I love her work and, really fighting for human rights and women's rights and, rights for different races and just all of her work in the field. But also my grandfather. My grandfather was a lawyer, but he was really a spearhead at really trying to identify how to work with juveniles who were in the system and trying to advocate for mental health services in the 40s and 50s.
Oh,
So
wow.
he was really advocating for treatment that I ended up doing when I was in grad school and after the fact, and he didn't know that that treatment existed. So it was really neat to kind of see the groundwork that he was doing, and then I'm continuing it as the clinician.
Wow,
So,
that's wonderful. I love that. Okay, what is something that you cannot go a day without?
I guess personally, I love to exercise. That's kind of my mental health tool, is that I need my own time to exercise and, get myself grounded, but just having time with my boys, spending time with my two boys.
And that's usually exercise too, right?
That is, yeah. Two active boys.
Okay, life is better with,
My family.
yeah,
Yeah.
simple, but
Yep.
the truest answer, right?
Yes.
Okay, and what would your advice be for somebody young? While you're young, you should,
Play.
I
Play.
agree more. Fun now while you're
Yes.
young and energetic.
Exactly.
Okay, and finally, what the world needs right now is,
Understanding and perspective. Perspective taking.
interesting. That makes sense. Well, thank you so much for being here tonight and for
Absolutely. Thank you.
like I said, I'm going to link your book. You guys can find it in the link that I share here. You can go to it. You can learn more about Dr. Aries and control theory. So thanks again so much for being part of Mondays with Maddy.
Absolutely. Thank you so much.
Okay, good night.
Good night.